This is Good Morning Mumbai with Hrishikesh.
That's Panama Van Halen. Today is World Voice Day, and on the occasion of World Voice Day, we're streaming online audio across the nation on www.onecast.in, numeral 1cast.in. And of course, if you're not driving, statutory warning: if you're in the backseat of a chauffeur-driven car, backseat of a radio taxi, at home or at the office without a radio set. We're streaming video live on facebook.com/HRISHIKAY. That's HRISHIKAY on Facebook. Sanjiv Badhwar, Dr. Sanjiv Badhwar, is one of the gurus of ENT, and I'm pleased to welcome him onto the show. He's consultant ENT, head neck robotic surgery at the Kokilaben Dhirubhai Ambani Hospital in Andheri West, and really, to me, the foremost ENT person in this country. Wonderful to see you, Doc. How are you doing?
Good morning. It's great to be back.
Absolutely. The significance of the voice and why voice is important, and what really is the emphasis and the speciality of World Voice Day, Doc.
Okay, so I'd like to quote W.H. Auden. All I have is a voice. So basically, World Voice Day was conceptualized by a group of Brazilian laryngologists in 1999. They thought voice is so important, it helps us to communicate, it colors the perception of who you are. So they decided to dedicate one day to voice issues, to create awareness, and also to tell us about the solutions we have. This was picked on by the European Laryngology Society in the early 2000s, and today, worldwide, 16th April is dedicated to voice.
Lovely. And how well has the field developed in our country? I mean, it's a field that you've been working on for a while, ever since you passed out of your MBBS at the Armed Forces Medical College, and then you went on to do your MS. So tell us about the development.
I trained with Dr. James Thomas in Portland, Oregon, and he inculcated in me a love and passion for voice and voice-related issues. So basically, we also are part of a team called the Laryngology and Voice Association. I've been past president of this. And this is to create awareness. This is to cross-consult amongst colleagues who are interested in this field to create best practices.
Wonderful. What kind of problems do people normally come with as far as the voice field is concerned?
Hrishi, you'd be amazed. The first cry of a newborn, when the child is born, the cry. That tells you, is the child healthy? Does the child have any breathing issues? Are there any congenital problems which need to be addressed? So it starts from birth. And the whole span till the age of 60 or 70. So essentially, people come with hoarseness. People come with a breathy or husky voice. People come with the inability to speak. And then you have the other end of the spectrum. People who unfortunately have had malignancies of the voice box and have undergone some form of surgery or therapy and need help to improve their voice.
All of that and under the able eye of Dr. Sanjiv Badhwar. We're going to come back after Michael Learns to Rock someday, and this specially is dedicated to your team. You want to shout out to them?
Yes, ENTKH, way to go.
Way to go. Here we go. Someday, somewhere, together we will be baby. 10:08, Dr. Sanjiv Badhwar is back right in a couple of minutes. Someday, somewhere, together we will be baby. My Michael Learns to Rock. Dr. Sanjiv Badhwar shouting out to his colleagues, his co-workers there. It's World Voice Day. And it's such a significant day. And this is a man whose area of expertise includes laryngology, cochlear implants, robotic head and neck surgery, balloon sinuplasty, and really one of the foremost ENT people in this country, Sanjiv Badhwar. The significance of World Voice Day is that the Brazilian Society of Laryngology launched it in 1999, and the idea is to devote a special day each year, today, the 16th of April, to the voice, which is such a wonderful tool for all of us. More conversation. Now we're streaming video live only if you're not driving. Please catch our video feed on Twitter and Periscope at HRISHIKAY. Online audio across the nation on www.onecast.in, numeral 1cast.in, and on your radio sets in Mumbai City, 94.3 on the FM band.
This is Good Morning Mumbai with Hrishikesh.
What are the signs a layperson should look for to know that there's something wrong with the voice?
Okay, that's a good question. So basically, any unexplained alteration in the voice for more than 15 days, change in the kind of voice you have, a breathy voice, a hoarse voice, breathing difficulty, sometimes associated with cough, a blood-tinged sputum, sometimes associated with difficulty in swallowing. These are warning signs, and you should consult your ENT surgeon.
Who are the people at risk for voice disorders, Doc? What bracket of people?
This spans the entire age group. You have children who shout and scream. You have voice professionals, teachers, singers, and otherwise people from every walk of life who use their voice professionally, or there is some evidence of vocal misuse.
But a lot of people would turn around and say that if there's heavy breathing along with the hoarseness of the voice, it's a lung complaint as opposed to an ENT complaint. Why do you say it is an ENT complaint?
Okay, that brings us to the question. It's all about teamwork, and there's this concept of one airway. So one airway stretches from the nose down to the throat, to the vocal folds, and to the lungs. Every part of this is very intricately entwined, and you may have problems with the lungs associated with voice, you may have problems with vocal folds, tonsils, palate, all come together. So it's important to reach your medical practitioner, and then he will take the journey to find out what exactly is wrong.
When is the right time to seek attention for a voice disorder? When should one seek that attention, Doc?
Like I said, more than 2 weeks of any alteration in voice, please consult your ENT.
This is a question that, you have lots of people walking through the door at Radio 1 wanting to be radio presenters, wanting to take an audition, asking us, saying, hey, my voice is a little weak. Can I do something about it? You must be getting that asked a lot,
yes.
At dinner parties, cocktail parties, and where you consult. So what is your answer normally to people who say, my voice is weak, can I do something about it?
Okay. So Hrishi, when our hospital was set up, I was given the mandate to set up one of the best care centers for voice because we are close to Bollywood. So essentially, it's all about teamwork. You have everything in place for someone who may be a normal individual, normal voice, but would like to seek a career in something to do with voice. So here, embark on a career. We do an examination. We do something called a stroboscopy, which tells us how your vocal folds are functioning. Are they stressed out? Can you reach a high note? Or are there signs of vocal misuse? So it's essential before you embark on such a career to have yourself examined. We also have something one of its kind. We have a recording studio which is state of art, which records your voice, and you can listen and find out if there are nuances where you're going wrong. And we have a team in place of 10 therapists who deal with the voice, who can help you with that.
Lovely. Would you just go give out coordinates, Doc, where one can call and where they can email you, please?
Yes. So the contact number for anyone with voice-related issues is 771-881-0080.
Repeat that again, please.
I would repeat, 771-881-0080. And the mail ID, ent.kh@relianceada.com.
Again, repeat the email ID, please.
The mail ID again is ent.kh@relianceada.com.
We're going to take some messages and come back with Dr. Sanjiv Badhwar. It is World Voice Day today, the 16th of April, celebrating voices around the world. 10:16, I'm Hrishikesh.
94.3 Radio 1.
Brian Adams' Life is an Open Road, 10:24 in the morning, absolutely live with Dr. Sanjiv Badhwar, who's the guru of ENT, a man who's had an extensive career, and look at the kind of qualifications he has. An MBBS from the Armed Forces Medical College in Pune, an MS in ENT Mumbai, fellowship head and neck oncosurgery, Tata Memorial, fellowship in laryngology, the Voice Institute, Portland, Oregon, fellowship in robotic surgery, Severance Hospital, Seoul, South Korea, fellowship in cialendoscopy at Geneva, Switzerland. More conversation on World Voice Day today, the 16th of April.
This is Good Morning Mumbai with Hrishikesh.
Radio 1.
Parents must be coming to you all the time, always conscious of their child's voice. And the logical question is, my child has hoarseness, what should I do?
Yes, that's something which happens often. The parent of a child comes and says, my child is hoarse. What do I do? Firstly, there is no cause for alarm. Every child shouts, sometimes screams, and you get what is called screamers nodules. So the first step is reassurance. The second, a formal ENT examination, which sometimes includes a flexible laryngoscopy if the child is cooperative. If the child is not cooperative, we have a state-of-art software where you can speak into a mic and your voice is analyzed and you come to know how you're using your voice. Is it gruff? Is it breathy? Is it hoarse? And also gives you some insights into your voice use. Based on this, we offer therapy. We have a voice coach dedicated to voice at Kokulaben, and therapy, reassurance, and changing of practices usually helps. Intervention in a child is often the last resort. When all these measures fail, sometimes you do have to intervene. Herein, we examine the child under anesthesia, and we're usually very conservative in whatever we do, but we have solutions.
What is the flex laryngoscopy that you just talked about?
Okay, Hrishi, you see, when you have to examine the voice, it is done in two ways. You have an instrument called a laryngoscope, which is through the mouth, but a lot of people have a gag reflex. So the other one is a thin scope which goes through the nose and gives you an insight into how your vocal folds are moving. Do you have nodules? Is there any tremor? Are the vocal folds closing? And all these inputs are put into use when therapy is offered.
Okay. Now, this is a voice professional's question. Often you'll have voice professionals coming into you and saying, I have these mammoth tonsils. I don't want to get them removed because, when you're a kid, you're told remove your tonsils. I don't want to get them removed because I'm a little worried whether my voice quality or texture will change. What's the solution to that?
Okay, Hrishi, that's a very good question. You see, when voice is produced, the bellows are the lungs, the vocal folds vibrate, and modulation, which is most important, takes place from the palate and the tongue, and the facial pillars or the tonsils. So every part of this is important. So for a voice professional, we are extremely conservative. I would back away from really advising any surgical intervention for tonsils, but we have other solutions. A formal examination. We have a state-of-art allergy clinic at our hospital. You'd be surprised at how many of them turn up to have dust allergy, lactose allergy, gluten allergy. So we address that because now we have oral vaccines which are easily taken. So the line of management would be a formal examination, do an allergy test if indicated, check with our team in gastro in case there are any signs of acid reflux, which is very, very common. Lastly, at Kokulaben, we run an adult immunization center where my colleagues would advise vaccinations which normally cover all the bacteria and the viruses which affect the throat. So combination of this usually works, and surgery is the last resort for voice professionals.
Okay, we're going to go into Akon and Lonely. And who do you want to dedicate the song to, Doc?
Again, my team at KH, who stands rock solid behind me.
Yeah, manager in particular, yeah?
Yes, sir.
Lonely Akon, back with Dr. Sanjiv Badhwar. It is World Voice Day, 1029. I'm Hrishikesh. You have any questions, any comments? I'm happy to read it out, bring it on air with Dr. Sanjiv Badhwar. Anything to do with ear, nose, throat. One space your comment or one space your question and your name to 53650. 53650 is the in-studio SMS line. On Twitter as well as Facebook, you go to the search bar, you type HRISHIKAY and you tweet out your comment or question, post on the timeline inbox on Facebook and facebook.com/radio1.mum, our official page. Any comment you'd like me to read out, any question you'd like me to bring up on the show, put it on the timeline inbox along with your name, and yep, you'll hear your name and your comment or your question on the air. 10:29, and see you in a couple of minutes. Lonely by Akon, going out specially from Dr. Sanjiv Badhwar to his manager and his wonderful team. And And this is a man who is Professor and Head ENT at the Army Hospital Research and Referral, New Delhi, Professor ENT at University in Pune and Mumbai in Delhi, President, Laryngology and Voice Association of India, really India's foremost consultant ENT and head neck robotic surgeon, in studio because today is World Voice Day. Indeed it is, the 16th of April, and everything to do with voice is being discussed.
This is Good Morning Mumbai with Hrishikesh.
Radio 1.
What are singers' nodes? I mean, this is something that we hear of often. Tell me about it.
Okay, Hrishi. You see, basically, the middle of the vocal folds is the part which vibrates the maximum. And people who sing and use their voice professionally sometimes have a little swelling here. Sometimes it's a little bump. Sometimes it's a little more than that. So the effect of that, what happens is, it dampens the vocal folds. Your mucosal vibrations are not as efficient as they should be, and you don't get what is called a complete closure of the voice. So then when you try to use the voice, when you try to hit a higher note, there is a strain on the voice and a vicious cycle sets in, which affects the performance.
Okay, we've got a couple of interesting comments that I want to read. Deepthi Sutaria, wishing you have a more beautiful voice day by day on World Voice Day. Hrishikesh, thank you so much, Deepthi. And Suhail Merchant says, amazing Hrishikesh, I didn't know about such a day being observed. Thanks to Dr. Sanjiv Badhwar, your guest, you bring to the fore health issues which are generally neglected. All I do is shine a mirror to this wonderful man. Now, let's talk about signs of cancer in the voice box. You know, what are those initial signs that one should see, and it should almost be like a flag, a red flag going up?
Okay, you see, the cost of healthcare is spiraling and prevention is better than cure. So essentially, someone who smokes, who's a tobacco user, who does imbibe alcohol, or is working in an industry which is polluting, be it rubber, plastics, or sometimes wood-based industries are exposed to smoke and pollutants. These people are at risk, and the warning signs are hoarseness, change of the voice, unexplained cough, sometimes cough with a tinge of blood, or swallowing difficulty, or sometimes in an advanced case it could be a swelling in the neck.
So, can a patient who has cancer of the voice box actually speak after surgery?
Okay, that brings us to the question, what are the therapies which are there today? So basically, you have the whole gamut. But today, science and medicine is changing, and we now focus on quality of life. So we have what is called the organ preservation protocol. First and foremost, not everybody with a voice cancer loses his voice. We have excellent modalities. Early voice cancers are sometimes treated with laser alone. And at Kokila, we have what is called the ultra pulse laser. This is a carbon dioxide laser which has minimal thermal damage, and sometimes with just a laser excision of the lesion, that suffices and the voice is preserved. In more advanced cases, sometimes radiation is offered, sometimes chemotherapy, and as a last resort, sometimes surgery of the complete voice box is done. But then there is hope too, because you have devices and prostheses which give you a different kind of voice, but you can speak and perform your normal functions.
Wonderful. We're going to take some messages and come back for a last leg of conversation with Dr. Sanjiv Badhwar. We're actually going to talk about, is there a scope of improvement for people who are professional voice users? And what do people who have issues with swallowing do? And just sign off on this wonderful interview on World Voice Day. Questions, comments, welcome. One space, your comment and name to 53650 on SMS, HRISHIKAY on Twitter as well as Facebook, and facebook.com/radio1.mum. On Facebook, you drop a comment in the timeline inbox. 10:38. See you in a bit. I'm Hrishikesh.
94.3 Radio 1.
Mike and the Mechanics, all I need is a miracle. It's World Voice Day today, the 16th of April. Dr. Sanjiv Badhwar, India's foremost ENT person, India's foremost head neck robotic surgeon, is in studio. A last leg of conversation.
This is Good Morning Mumbai with Hrishikesh.
Radio 1.
Doc, what do people who have issues with swallowing do?
Okay, That's nice. You see, voice and laryngology has taken a C-turn. We've realized that swallowing is also an intricate part of the voice mechanism. Both work side by side. So the field is now called laryngology and swallowing. For this, we have a lot of issues at hand. People come with us with changes in the voice and swallowing issues, or they may come alone. So for this, we do special studies called a modified barium swallow. We do another study called FEAS, which is basically an endoscope is placed and the patient swallows, and you come to know, is there anything wrong with the swallowing mechanism? We also conduct manometry studies, which tells us about the pressure in the food pipe. Based on this, we have therapy, which is again conducted by our therapists, which sometimes there's some kind of maneuvers, exercises, massages, which normally help out. At times, you may have to use medicines like Botox, and sometimes there are surgical corrections depending on what's the issue at hand.
Now, I'm sure a lot of voice professionals, professional voice users, whether they're singers or actor performers, come to you and say, I want to improve my voice. What is the scope for improvement of the voice?
Yes. So first we conduct what is called a stroboscopy. A stroboscopy basically is an examination of the voice mechanism, form and function. That tells us, is there any defect? Is there any problem in the way you use your voice? Next step, voice analysis. Post that, our voice coach, voice therapist comes into play, and therapy normally consists, again, it's important that to create voice, it's not only the vocal folds, your muscles, your posture. Do you warm up? Do you cool down? Do you smoke? Do you take a lot of caffeine? All these things come into play, and therapy normally works well.
Wonderful. What about neuro issues? Where does ENT come into play as far as neuro is concerned?
Okay, that's a very, very wide spectrum. You have patients who've had stroke. You have patients with dysphonia. So that's a huge group of people out there who need assistance. Normally, people with neurological disorders has some form of dystonia. That is, things are rigid, things are not moving, and they're not flexible. So as part, we have a team in place. For voice, we work with our colleagues in neurology, colleagues in rehab, and we have a comprehensive program in place where therapy, measures, exercises, sometimes Botox, sometimes suppose your vocal fold is weak and is not closing, we have a thing called injection laryngoplasty, sometimes surgical maneuvers, which normally alleviates the problem.
Doc, I have to say that this has been a really enlightening session. Something that a lot of our listeners are going to be taking home and mulling over. And just to sign off, you talked briefly about voice therapy, some other aspects of voice therapy that we haven't talked of.
Yes, so basically we have trained professionals in place who normally, after assessment of the voice, do maneuvers. There's a thing called laryngeal massage. Sometimes you see, you have children who have a squeaky voice, and just by elevating and some maneuvers of the vocal folds, sometimes of the Adam's apple, it helps in giving you a near normal voice. So therapy normally entails some maneuvers, laryngeal massages, neck relaxation exercises, and do's and don'ts. Take care of a voice. It's a beautiful thing.
Sheldon Naranio says happy voice day to you and Kobad and Dr. Sanjiv Badhwar. Thoda kaam humko bhi de do sir ji. Brother, your talents lie elsewhere. Why would you want to come in and do what we're doing here? But thank you very much, Sheldon. Happy voice day to you too. Doc, before you go, where can people reach you? And after you tell us where to reach you, there's a special dedication you want to make.
Yes. So please reach out to ent.kh@relianceada.com. I repeat, ent.kh@relianceada.com, or call on 771-881-0080. I repeat, 771-881-0080.
Wonderful. Who would you like to dedicate every breath you take, every move you make by the police to?
I would like to dedicate this to my wife, Anuradha, and to my beautiful daughters, Sana and puja.
Wonderful. God bless you, Doc, and see you soon.
See you soon. Thank you.
Dr. Sanjiv Badhwar there. Up ahead, T20 Premier League cricket action, the Teetotaler. That's also coming up on the show, and how you can win yourself a wonderful vintage vinyl. 10:53, I'm Hrishikesh. Here's the police.